Hmm.
I want to welcome you into Coronavirus Inside the Arizona Numbers. A lot of you were just joining the live stream, listening in to Governor Doug Ducey's update. We have not heard from him in 20 days. A lot of people waiting for whether there would be closures, whether schools would be shut down, whether there would be a statewide mask mandate. None of that came today. We did hear about some new efforts happening over at the airport to let our winter visitors know the rules, so to speak, here in Arizona, and to make sure that they're taking all the safety precautions. We want to walk you through all the numbers here in Arizona as well. I want to hear in the comments what you thought if you were listening into Governor Ducey's update on us, and what the plans are for us here in Arizona. So, Garrett, without further ado, sorry, there's a vacuum starting in here. There's a lot of construction going on in the ABC 15 newsroom, and cleaning apparently. So let's check in and see how the numbers look today here in Arizona. I know we did have a really high day of numbers.
Yes, we did. So let's go right into it. Today, the number of reported cases is 3,200. That brings our 7-day average now to 2,500. That's the highest the 7-day average has been since it appears about the late July. So now we were sort of in the late August or middle August period. Now we're in the late July period. So we're getting closer and closer to the peak case numbers. As far as the deaths, 53 deaths were added today. These were very recent, sadly. These were not deaths that were added over an extended period of time, only about the last 2 or 3 weeks. The vast majority of these deaths were added at that point, and this is the highest reported death number since about September 3rd. They are increasing. Our death average is now moving to, it's about 19 a day right now, and we'll see where that goes. Most experts believe that that number is going to increase. We're supposed to sort of get to a peak of daily deaths in the next 2 weeks or so, because I guess Thanksgiving is next week. I didn't realize that until shortly. But we are getting put to the point where experts think that we're going to start leveling off on some of these numbers. We don't know if that's the case yet. We just know that's what the modeling says, and we'll go through that a little later.
Yeah, we'll talk about some of the modeling and some of the numbers that we're seeing. During the news conference, he was talking about 90% of the state being under a mask mandate, and that it's in his eyes not needed. That's to be debated by a lot of people on here. I'm seeing some of the comments as well. Some people thinking that if 90% is already using it, maybe it's just it's not really doing anything, but just sort of a feel-good mask mandate. But a lot of other people really wanted to see that happen today. So for those of you just joining us again, that did not come about today. Let's look at the numbers, though, in Maricopa County and how that reflects then. I know there are 180,000 cases in Maricopa County since this pandemic began. The majority of the 3,200 cases reported today were in Maricopa County, which is obviously what we expect to be reflected here when we have 4.4 million people just within this county. But how do the rest of the numbers shake out?
It was about the same as far as proportionally. About 2,000 of today's 3,200 cases were from Maricopa County, and about 28 of the deaths were from the county as well. And that's sort of what we've been seeing is the death numbers are slightly over proportional in Maricopa County than other places. It's an urban area, so you're going to see a lot of this occur sometimes.
Yeah. What effect do you think that has from long-term care facilities? Because we have more here in Maricopa County. Is that sort of reflected in those numbers as well?
Let me look at that really quick, since I can't actually talk about that. I'll just have to pull it up really quick. So in Maricopa County, for example, let's just look at, so far we have 1,284 deaths from long-term care facilities reported today. When we look back, say, the same time last month, so October 18th, that number is 1,213. So it's actually not that much as far as the number of deaths that are coming from long-term care facilities right now.
Yeah, I'm seeing a lot of the comments. If you're compromised in any way, or you can't wear a mask, stay home. The problem then becomes with that methodology is that somebody in most of these cases has to be there to take care of this population as well, and those are people that are not in that age group that would have to be forced to stay home. So the idea of saying, well, then this group, this sort of ageism type attitude or ableism type attitude, like this group can just stay home. If that's the case, they have caregivers who are not in that group that would not be required to stay home. And therein lies the trouble with that idea.
And let me show you something in that regard. I'm just going to go to the Maricopa County COVID site really quick and then bring up something. And this is basically the long-term care facilities and the death numbers.
Mhm.
And it's something to sort of look at because it really, Maricopa County does a great job of showing us what these numbers look like over time. And so what they did is they actually have two different colors for their deaths, for COVID-19 deaths. Long-term care facility is in this darker color, this darker grayish green, and then the gray, the lighter gray is it's just deaths in the community. And you can see, obviously, the vast majority of our daily deaths in Maricopa County came in this later, we had our peak here as far as cases, and then deaths they continued for quite some time. And you can see, obviously, the long-term care facilities picked up at that point. If we take this back farther, what's interesting is you can see early on in this pandemic, when it was first hitting Maricopa County and everywhere else, it was really the long-term care facilities were taking the brunt of the deaths. In fact, it was upwards to 73, 83%. Somewhere in the high 70, 80% was coming from long-term care facilities. That's where the deaths were coming from. And then as soon as COVID-19 really started spreading into the community, you can see obviously the deaths, while still large for long-term care facilities, they no longer made up the same proportions.
Right.
And what the good thing is, what we're seeing now is that even though the deaths have decreased, which everyone wants to see the deaths decrease, but the long-term care facilities have also decreased with it. And that's a great thing because, if we were looking where we were back before the first surge, obviously the vast majority of deaths coming from long-term care facilities, and now they're not. It's still sort of same proportionally. There's just less deaths happening in long-term care facilities now, as well as in the community. So hopefully, while we've seen all these increases in cases, and I'll go to the case numbers to show you this right now. Obviously, we've seen we're about half of where we were right now in Maricopa County, and as well as other places. But we have not yet seen a significant increase in deaths. We're starting to see higher daily death numbers that could obviously very quickly translate into a higher, this curve actually starting to increase. You can see right here, in fact, that once these numbers are filled in, this line, this average line, is going to increase. So we are in a small increase for deaths right now. But as of right now, not picking up the same way that cases and hospitalizations and everything else are picking up.
So while we're on this page, Garrett, I think it's a really helpful page for folks who, I know there's a lot of new faces on here with us today. We have a lot of people who join us every single day for our conversation here. And we want to welcome all of you in, our regulars, if you will, and all of you that are just joining us for the first time. I want to show folks on here how much data we're able to get here on this particular page. Now, we're using an example. This chart is coming from Maricopa County, this information coming from Maricopa County, the health department. And we're so lucky that we get so much information like this, but let's show everybody what else is on this page.
Sure. So what we already talked about, this is obviously the graphs of all cases, hospitalizations, and deaths. And what this is this is the date of occurrence. So this is anytime it's registered. Sometimes things can be added 10 days ago or whatever, but it's on the date of occurrence rather than the date of reported. And then we have overall case statistics in Maricopa County. This is just basically this is what we give every single day when we first start this the COVID-19 briefing. We do it for the state. The ACDHS does it. This is just basically the rundown of what the stats look like at the highest level. And then what it does is it breaks this down further into age groups. You can see a hospitalization of 1% of COVID-19 cases from this age group are hospitalized. 30% from this age group are hospitalized. So obviously you can see that while 8% of Maricopa County COVID-19 cases are hospitalized, the vast majority of them are coming from the 65 demo. And then when you look at the ICU, very low ICU numbers, 0, less than 1%, 1%, and then 5% of 65 plus are ICU. And then here are the death numbers. And this one, of course, is always the hardest to look at because it's 15% of are died from COVID-19.
Yeah, of those over the age of 65.
The fatality rate for over 65 is extremely high.
Yeah, so you see why it's so concerning to that group in the population. So overall, Garrett, we've seen about anywhere from 11 to right now, we're lucky enough to see that it's at 8% of the hospitalization rate of the entire numbers. So if you're testing positive in Maricopa County, 8% of those people right now are ending up in the hospital, but we've seen that sort of fluctuate throughout the pandemic.
Of that group, if you test positive for COVID-19, you're over a certain age demographic, that 8% really goes to 30% for you.
Yeah.
The chances go up a lot at that point. So that's just something to consider when you're looking at these, because I know everyone likes to throw out the 99% recovery numbers, that kind of stuff, which, I mean, look, there's ways to talk about that. I'm not going to talk about this very moment right now. It's a little deceiving, but I understand where they're coming from when they say those numbers. But if you're of the 65 age demographic, those numbers are meaningless to you because, as I said, if you get tested positive with COVID-19, there's a 30% chance at this point you're going to the hospital. So
yeah. Okay. So as we look at this page, any other things we should stop on here? Maybe just a few of the more.
Yeah, we'll go through. I don't talk about this one a lot. This is the race ethnicity of these rates. Basically, what this tells you is how the rates for American Indian, Black African American, White Asian Pacific, it's showing you what these rates are per capita. It shows how obviously Native Americans have had a much higher per capita number than whites or any other ethnicity. And the reason they put these numbers in the way that they do, and then you click ethnicity to go to Hispanic, because by the Census Bureau, Hispanic is an ethnicity. It does seem to be slow here. Here we go. And it shows that, again, when you look at ethnicity, Hispanic or Latino has a much higher case per capita. And the reason these are per capita numbers, of course, is that, obviously when you look at a census numbers for Arizona, Caucasian white makes up 70 something percent of the population. So in order to really get a good idea of how this is impacting different groups, it's always best to do it in per capita. Risk factors, we'll go through this really quick. This is sort of something very important to look at. We've already sort of talked about these. This is basically saying the same thing we've talked about, but now we're looking at a 100% chart. So if 73% of the deaths that have happened in COVID-19 in Maricopa County have come from 65 years, come from this age category, 56% of the ICU, 39% of the hospitalizations, so on and so forth. And the highest risk category, very important. This is highest risk. This is anybody who is 65 plus or has at least one chronic medical condition. And you can see 83% of the deaths in Arizona, or in Maricopa County, sorry, have come from someone who is in this category.
Yeah, and as I always remind everybody, split that chart off after 65 years. So when you're looking for totals to 100 in there, the first four sections are one chart and the bottom two are a separate one. So of note in all of that, we talked about the care facilities, and then we'll look at schools on here and then move over to kind of get a preview of what that schools dashboard is going to look like for everybody tomorrow.
So this one, what all this is telling you, this isn't the same as the other mapping dashboard that we use all the time, because that's basically using school jurisdictions, their boundaries, to make assumptions about what's going on with schools. This is actual school data. So we can see in this respect, we see that 56 schools, there's 74 schools in Maricopa County that are classified as having a COVID-19 outbreak. 56 of them are open and 18 of them are closed. 351 either students or staff in Maricopa County have had COVID-19, and that's 266 students and 85 staff.
So this is a helpful chart for anybody who wants to just take a peek at the overall look at how our schools are doing here in Maricopa County. Tomorrow is Thursday. Thursday is the day we get the big update on how each school district is looking through that schools dashboard map. It used to be, Garrett, when we started this early in the summer, we wouldn't get that update until late in the evening after we had completed our chat here with everybody. But now we're getting that at 9 in the morning. Are there any sort of previews that we can get from that? Because what we saw last week and what I think most parents and grandparents are concerned about right now is last week, those numbers came out on Thursday, and by late Thursday night, Thursday afternoon, here in the newsroom, and a lot of us parents were already getting emails from the schools saying, that's it, we are not even going to be open the next day. So this is the warning to all parents and grandparents. Make sure you have a backup plan, a child care plan for when this thing goes into action, because likely tomorrow we're going to see more schools that are doing the exact same thing that we saw from several groups last Thursday.
Yes, and I'll just share the map really quick. I just realized I have to push share screen. Sorry about that.
That's okay.
Again, we'll go over this. I'm not going to go over any zip codes or go through things that right now because nothing's changed from last week. But we're going to go over this in depth tomorrow. This is the Unified School District map for Maricopa County. We are seeing now that schools, as Katie said, are relying on this map in many ways to make decisions on what they're going to do. And you can see, obviously, of the school districts, the entire East Valley is considered substantial. Scottsdale, Peoria, Deer Valley, and then these are moderate, but they're very much on the line with moderate right now, and I'm expecting that several of these will also flip red, and that we will not see any of these move back to yellow for this next update tomorrow. And that is essentially the same for all school districts, mind you. There is a chance that all high school districts will be in the red tomorrow. And then elementary school districts, again, these school districts, very dangerous as far as, I don't want to say very dangerous, like they are dangerously close to becoming red. Their numbers are high. They are dangerously close to becoming red, is what I was trying to say. I don't know what's going to happen with these rural school districts. They're a little harder to tap down. But these urban school districts, there's a good chance that all of these are going to be red in tomorrow's update. We'll see, but that's sort of what we've seen using the zip code numbers.
So when this Sarah survey was done, a month or two ago now, time is running together, Garrett, honestly. The Sarah survey was done here in Maricopa County, and that was a randomized testing to sort of find out how much coronavirus is present here in Arizona. And this would be testing based on neighborhood. It was totally random. It's like, let's pick this neighborhood, let's test enough people. I believe the target was testing 500 people. The results came out from this, and they're saying 1 in 10 people in Maricopa County has had coronavirus.
Correct.
An incredibly
the numbers do bear that out, and we've seen when we've looked at our modeling on, if you recall the modeling we used to look at that was checking, those numbers that said this is the COVID agnostic number. It doesn't matter what the confirmed case number is. This is what we believe is infectious in the community, and it was around that. We did see that they were saying around anywhere from 10 to 20% of Arizona had already contracted the virus at that time, and we're still sort of in that area. So yeah, absolutely, it makes sense when you look at the numbers.
So one of the things that we always want to express on here is that recovery numbers, we don't necessarily, as I always say, recovery is different for everybody. Somebody can feel great again and consider themselves recovered. Somebody could test negative and consider themselves recovered. Some people, it's different for everybody. So recovery is not a term that we like to use, but we do like to try to find out what active cases are out there in Arizona. And as I always say, you take 283,000 cases that we currently have, you're subtracting out, sadly, the 6,300 people that we've already lost here in Maricopa County. And then you look at the collection dates. If it's older than 2 weeks old or so, and I'll let you get in the specifics on that, you're able to help our viewers sort of find a range of how many active cases there would be out there.
Yeah, and this is based on the confirmed active case number, like you said. Those who have actually gotten tested and have tested positive. So there are going to be some people that are not in this number, because especially in that younger age group, because a lot of people just pass COVID-19 when they're 19, and they don't even realize they have it or barely realize they have it. So this wouldn't include basically a whole bunch of people that had very minor symptoms and perhaps didn't get tested. But for the ones who did get tested, the recovery rate, or the active rate, if I will, for that number is 32,000 at the low end and 52,000, 53,000 at the high end. So basically in Arizona, we have anywhere from 33,000 to 53,000 people who were confirmed
Mhm.
and are still infectious with the disease right now.
Mhm. I'm seeing some comments on Cuomo and the sentence or phrase that came out of New York this afternoon. So if you haven't heard, what some people are talking about in the comments is New York City schools have shut down. So de Blasio shut the schools down when they reached 3% positivity rating in New York City. As far as New York State, they were making their decisions on Thanksgiving and helping people in New York have some guidance on this. And he said, don't be a turkey. Don't be the turkey on Thanksgiving. Don't make dumb decisions here and make the rest of your family sick or cause a super spreader type event, whether it's your neighborhood or your family members that are getting together. So I'm seeing a lot of comments on that there right now. So right now in the United States, Garrett, we have 75,000 people in the hospital, 75,000 Americans in the hospital right now. I know we can break that number down to show just how many are hospitalized here in Arizona and what share of that we hold. One of the things that was just discussed here in our news conference is that the question brought up, do we have enough caregivers? Do we have enough healthcare staff to take care of all these people? We've talked about the capacity in the hospitals, and we talk often about, do we have enough beds? And one of the things that was brought up this summer, and now here it is again coming up, do we have enough people? And in the summer, we were able to bring people in from other places. But when everybody's having a crisis, how then do you make sure that we have the coverage we need? And then, God forbid, any type of crash or any other major medical emergency, to bring several people into an ER that's already maxed out. How in the world do they deal with this? What do our hospitalization numbers look like here?
So, and it's a good point you make as far as this. So these are our hospitalization numbers right now, and this curve is fairly accurate. I used to knock on this curve a lot, but it's been better as of late as far as getting the numbers on here. So you can see that about 24,000 in total have been hospitalized in Arizona. That's about 8%. I'm also going to look at the hospitalization and bed usage. Now this is basically what our hospitals look like right now. So you can see that what is happening, and this is the ICU numbers, you can see that COVID-19 patients are increasing as a percentage of ICU patients, and the hospitals are having to maintain, they're going higher with this, the percentage of non-COVID patients, but as you can see, they're doing their best to convert, because they can't overflow the hospitals. They don't have the staff. They don't have the beds. Mm-hmm. So as the COVID-19 number goes up, the ICUs and other beds are starting to they're not doing elective surgeries. They're doing bed management, making sure that they have the space. That seems to be what's happening, because as you can see through all of these, you're seeing basically the same thing. COVID-19 increasing as a percentage of the census, but the non-COVID-19 relatively flat as far as trying to keep that bed cap around 80 to 90%. They got, when we all got very nervous in Arizona about what was going on, we were at about 90-ish%. In fact, we are, if you look at the inpatient numbers right now, and you look at the height, which was on July 10th, that was 88%, or a 12% headroom at that point. And now we are at 11% headroom. So, they're trying to keep the headroom about the same, but the COVID-19 patients are increasing. What we know about the COVID-19 patients is they take a lot more staff. And of the doctors that I've talked to, their biggest concern, as you said, Katie, is staff. Even though, they think that they'll have the beds, they don't know if they're going to have the staff. And that's what's kind of, messing with them right now. And that's it's even more pronounced in places like Yuma. So, for example, if you look at Yuma Regional Medical Center, just to touch on them really quick, that's basically the largest medical center in Yuma and Imperial County, California. So if you have COVID-19 in Imperial County, California, or Yuma, you're going to Yuma Regional Medical Center no matter what, because there's no hospital in Imperial County. So you're going to both that hospital is serving two counties. And I'm looking at the number right now. They're at 76 hospitalizations. At their height, they were at about 120. So they're over their sort of 50% mark on their number of hospitalizations. That is their total number of hospitalizations, by the way, not their COVID-19 number. Their ICU number's at 10. And what we are seeing is that they are starting to use the surge line at Yuma Regional now again. They were one of the most robust users of the surge line during the COVID-19
Height of this.
and they're starting to use it again. In the last 24 hours, they've added, they sent 3 other patients to another hospital. They don't tell us where they go, but they do say that they sent 3 patients outside to another hospital. So I like to focus on Yuma because it's one of the best indicators for us. That one and the Flagstaff Hospital, I forget the name of the Flagstaff Hospital right now, but really those 2 hospitals really service a lot of rural communities. And so it really helps to know what the stress is like of what's going on in those particular hospitals. Simply because while we look at this census graph for COVID-19, you have to remember most of these seats, most of these beds are in Maricopa and Pima County. So, while we're saying, oh, we have plenty of room here, that might not be the same for a hospital in Flagstaff or Yuma Regional Medical Center or something in Cochise County. That's just one of those things you have to consider, is that some of these other hospitals may not have 11% room. They might be much more in a much more worse position at this point.
I mean, Garrett, that absolutely reflects what we saw all summer. Remember early in all of this, and then as we were coming back out of it, we would hear from a lot of medical staff here in the group chat here on this live stream, and they would attest to their situation. And we could hear from traveling doctors who would say, when I go to this place, it's packed, and when I go to this place, it's not. So even though we are all one state, the flow and the situation that we're seeing in different counties and different areas really does. We really have to dive into the numbers to read what that means and read what it looks like for Arizonans in different places.
Yeah, and these hospitals, they report, and we get this information aggregated from the ASDHS, but these hospitals are not, for the most part, most of them are not government entities. So we're not seeing, they don't have an obligation to share their daily hospital capacity just by hospital. So that's why Yuma Regional is so valuable, because that hospital has chosen to give us these numbers on a daily basis. And so we can use it as sort of as a point, say, okay, we know that Yuma is now increasing again in hospitalizations, they're increasing again in cases. So it's a good way to see what it's like in the rural counties, simply because we know that that's one regional center that is going to get sort of high stress if COVID-19 gets worse, because they're the only game in town. Whereas, you hear people all the time in Maricopa County saying, oh, I'm not meaning to add a hospital, but like say Scottsdale Regional doesn't have any COVID patients, or this center doesn't have any COVID patients, and that might be the case. But we have a lot more beds in Maricopa County than they have in Yuma.
Yeah. Okay. So let's get to a few of the other topics, and I'm seeing some questions in the comments. One of the things is the test numbers. Well, while we were talking about high numbers and low numbers in different areas, one thing is for sure: we are testing a lot of people here in Arizona. I believe we have 2.3 million tests back for the entire pandemic, but this had to be a high or pretty close to a high of the number of tests that we got in, the results that we got in today.
Yes, we are now we have a new peak of tests. We haven't had a new peak in tests since the peak of COVID-19. This day, 11/12, which was 6 days ago, is now the peak testing day. 20,726 tests collected on that date. The original peak was July 2nd at 20,101. So we will continue. The difference now is that, of course, back when we were at this original peak, we didn't know this until weeks afterwards, because it took, at that point in the collection, the lag was 15, 16, 17, 18. It was almost a month in some cases, how long it took for tests to be processed. Now tests are being processed in anywhere from 2 to 6 days. So we're going to see these tests increase at a much faster rate and be able to sort of measure what our peak numbers are going forward, rather than having to look back retroactively by 2 weeks, 3 weeks and say, wow, that was the peak of the pandemic. Now we're going to be able to see as things happen, a little faster, which is good. It's good news in that's a silver lining, is we'll be able to tell what's going on a little faster than we were back then. We had no idea that we were sort of on the downturn until about 2 or 3 weeks after it happened in the first peak. Now we'll be able to tell if it happens.
And as you say, good news. There are a few highlights that are coming out today as well that we want to be sure to take a moment with. And one of the things is that the FDA has given the okay for the at-home test, so that folks could be able to test at home and find out how they're doing and get those results right away. Also, Pfizer's vaccine has come back 95% effective, and they're looking for clearance to happen on Friday from the FDA. So they're trying to get this thing in rapid motion. We also talked about messenger RNA and how that works, how the body is instructed to build some of coronavirus, not enough to make you sick, not enough to make you ill through all of this, but it just lets your immune system build up the defense, and then the messenger RNA eventually it disappears. It's not lifelong immunity, but a lot of people have been curious how that would work. And we've talked a lot about the 2 doses that would come in, and you heard Dr. Kara Chris talk about that too. They need to come from the same brand. So if you got the Moderna vaccine, your next dose would be from Moderna. If you got the Pfizer vaccine, then your next dose would be from Pfizer. So just some things to sort of keep in mind as we all start to learn a little bit more about these possible solutions as we get closer to them. A lot of the other questions in the comments were about the prediction looking forward and how things are going to look in the modeling that's coming out from a few different places that we've been tracking. Garrett, your choice, whichever one you'd like to.
Well, I'm gonna stick with Washington because my favorite one stopped updating. I actually haven't contacted the guy. I have to kind of contact him and say, hey, what's going on?
He's still there, yeah.
You haven't had that. In fact, let me check it right now before we move on.
So as you're pulling this up, the IMHE model for everybody is the one that has come out of Washington State. It was one that Garrett and I like to look at early on, and then it sort of had some anomalies to it and wasn't as trustworthy. So we had moved on to another one, which is a guy from, where was he from? MIT. I was going to say that, but love MIT. Thought I was just planning that in my brain instead. But from MIT, and now IMHE is the one that we've been looking at.
Yeah, he hasn't updated since October 5th. So
okay,
I can't
we'll go with this. We'll go with this one then and get some of the.
What I have said before, and I do believe this, is that the University of Washington has done a better job of sort of refining their model and sort of getting rid of a lot of the noise. A lot of the noise back then was due to what they didn't know what mask mandates were going to do. And so there were discussions, and when we were I have to share this while we're talking. Yeah, they didn't know what mask mandates were going to do, so they were basically putting these really, really wide-ranging variables on states that didn't have mask mandates versus states that did have mask mandates. So we would get, we were getting these reports that said, oh, Arizona's going to lose 10,000 people in 6 weeks or something, and it's like that's entirely unrealistic. So they had. After, obviously data has come in since then, a lot of data has come in since then, and they have refined these models considerably, and they are much better than they were. That was one of the reasons why I moved to the MIT model, was because the IME model, IHME model was just too varied. It was just way too wild.
So the address is right there on the bottom of your screen for anybody who wants to take a closer look at this. The pull down bar at the top where it says Arizona has state by state, and it has so much more information now. It has a global outlook, and you can also pull down different countries. So take some time with this site for all of you when you have some free time, or if you have to travel and want to see how that state's looking.
So right now, their projection model for Arizona does believe that we are in a sort of we're going to be seeing an acceleration of daily deaths. And that they bring it all the way out to March 1st. And their numbers right now are about, they believe that there's going to be 16,900 deaths in Arizona by March 1st. And that's going to be anywhere between 11,000 and 26,000 is their range.
It's a really high number.
Yeah. If we look at the daily deaths, this was at one point thinking that we were going to be leveling off, but it's made a change. It now believes that we're in an acceleration and that we're not going to level off on daily deaths until January 16th. And that brings us to their current projection is anywhere from 35 to 274 deaths a day. That's obviously a wildly different number. So that just, to me, when I see 35 to 274, that means that they don't really have certainty as to what the daily deaths is going to be, because that is just a wild estimation. Obviously, it could change. That changes things dramatically between 274 deaths and 35 deaths. But they do say we do believe it's going to be around 120, which would be higher than we had in our at our peak.
Yeah. As scrolling down to that, I just want to mention some of the comments coming up. Katie Smith writes, "We wear a mask so those we love won't be in that death count," the number that you're seeing there. And that's exactly it. Masks work, and we're seeing that reflected here.
This also believes that Arizona is going to be continued until about December 31st on a daily estimated infections. It believes that right now, today, about 12,000 people in Arizona are being infected daily, and they believe it's going to increase till it gets to about 17,000, and then it's going to start dropping pretty quickly at that point. That's their belief at this point, and we'll see how that bears out. That's obviously going to change as time goes on. Hospitalizations, when we look at this, it does at this point do believe that on, let's just go through ICU beds. ICU beds, it does, yes, it does actually, well, let's see, where are we? That's interesting.
The available line is that stat line.
This is very interesting. I have to research this a little more on this respect, because it's saying that we're already above ICU beds available, and obviously we're not above ICU beds available. I have to look to see what's going on with this. And a hospitalization, that every model is a little different. So I have to look into this as to why they think that we're already in max capacity. As you can see, when you look at all beds, it does not believe we're in max capacity. So it seems that they have there's some sort of miscalculation, or at least an underestimation of the number of beds we have available, because I believe we have way more than 500 beds, ICU beds available in Arizona.
And Garrett, I think there's one more chart here. We'll go through that, and then I want to talk about this very high zip code here in Arizona that we've seen it jump in, and we'll get to that in just a second. But this last section for mask use, now we did not, just for everybody in the comments I'm seeing questions about, there was not a statewide mask mandate. The governor saying that masks are already required. He says in 90% of the state, whether that's enforced is a different story, but he's saying that that was not needed today and did not implement that. From this chart, what we're seeing here, Garrett, it tells us a little bit more about adding mask use in. So
this is, and just to give some idea of what this is from, how they compile this data is they compile it using, it looks like Facebook, this global symptom survey, a U.S. symptom survey from the University of Maryland, the Kaiser Family Foundation, YouGov, which is a polling system. These are all basically data feeds that are asking people if they're wearing masks. So when they ask Arizonans, are you wearing a mask? What this comes down to is that their observed number is about 66% of Arizonans are wearing a mask. They want that number to be 95%. That's the target number they're giving. But they do believe that we're going to remain around 66, 67%. This is their numbers based on those surveys, of course. That's the only way they have this.
Yeah. Okay, so let's get to that zip code 85756. And I know you look closely at the zip codes and keep us updated. And boy, I felt like we talked about 85009. It was for a long time, and how that was increasing. What's happening in 85756?
So this is an interesting zip code. I have to pull up the actual data while we're talking, but as you can see, and I'll put this on satellite really quick. This is a zip code in Arizona. I'll take it off satellite here in a minute as well, just so that it's easier to see. But as you can see, this is not an urban center in Tucson at all. So what was interesting about this particular zip code is that, and I'm looking for it and I can't find it. The number, I'm looking for the number of
cases.
Yeah, cases that came into the zip code today. Sorry, I'm here.
That's
is.
okay.
It is. So it's the number of, come on, you can do it. All right. Sorry. I'm like trying to do this on the fly at the same time, and it's obviously, okay. So sorry about that. 288 cases just this week alone in this zip code. The highest number added this week, 190 in one day, were added in this zip code. So this zip code, I'll just go in on it really quick. And as you can see, the Tucson International Airport, a couple of very small communities in this zip code, but otherwise this Desert Haven, this little area is really the only, even I don't even know if it's in the border. It is in the border, but this is really the only sort of suburban neighborhood in this district. So, what could be going on here? The only thing that could really be going on here is if you put in if you search to see if there's prisons, you can see that there are 4 prison complexes in this zip code: Federal Corrections Institution, the Federal Bureau of Prisons, and then the Arizona State Complex in Tucson. So to me, because this is such a rural zip code and there's really nothing else in this zip code, to have so many tests being added in one day, this indicates to me that it had to come from one of these 4 places.
So, and we heard about some increased testing in some of those areas as well. So hopefully we'll learn a little bit more about what's happening and be able to help them and help this area be able to get this under control. I'm seeing a question come up a lot in the comments, and producer Carrie, you don't have to pull it up, but someone's saying, "Hey Katie, if the masks work, why are infections rising?" And I'm going to say this because I believe we are all interested in science and we're all grown up enough to handle this answer, but it's kind of the same thing as if condoms work, why is she pregnant? So it's not 100%. That's the easiest way, Jim, to answer your question on there. It's never 100%, and there's user error in wearing masks. So this is only one method in keeping everybody safe. That's why we talk about wearing masks, staying 6 feet apart, social distancing, all the things that we list in there to keep everybody safe. So that is the idea, is to take a multi-level approach to keeping everybody safe through all of this. And that's why that comes up. So it's one level of protection in this big fight.
Yeah, and of course the problem, of course, is that it is, like you said, the one level protection, but it takes one person to mess up and then go to some sort of even small family gathering where everyone feels that they let their guard down. Because we all let our guard down when we do family gatherings, friend gatherings. You're not going to sit there with your mask on 6 feet away from your people when you're sitting there, like hanging out. But that's when it hits the hardest, is when people let their guard down. And there's several articles you can read on that just came out in the last couple of days regarding that, where people, they all of a sudden have COVID and they're like, I was wearing masks, I was doing the thing I was supposed to. But, then I went to this, a dinner with some friends. There was only 3 of us. We all thought we were social distancing, whatever. And it just took one person that, was unaware of what happened, had let the guard down, and it got, goes to all of them. So that's sort of the biggest problem, is while masks do work, obviously we're not wearing them around our home, in our families or whatever. And that's where
the spread happens.
That's where it gets in.
Yeah. It's called the Swiss cheese model. So you have to have several layers of that protection, but you can have user error in all this. And so wear your mask. Masks work. They work. Stay distant. Do all the things so that we don't have to keep updating you every day, and our healthcare workers can get a break, because now we know that there's nobody else to be called in. We've got what we've got here in Arizona. We can't call on another state, as we did in July, to sort of help us out. So with that said, thank you to all of our healthcare workers and providers out there who are working around the clock. I know so many of you join us on here, and I've seen a couple of comments that they're working 13 and 14-hour shifts. So thank you to all of you who are in that field and are joining us on here and providing your insight to our afternoon chat as well. All right, Garrett, in the last few minutes, I want to remind everybody that Thursdays are a very, very busy day for us, because the zip code map is going to be updated. That is important for the schools who are making decisions about keeping your kids in school for longer, or possibly, in my kids' case, sending them home until January. So we're seeing a lot of that coming around Arizona, and we expect more tomorrow when those numbers do rise. So we will track all of it. You will see Garrett's insight into these numbers and what's changed and how that looks. We'll do that at the same time, same place tomorrow. All of our coronavirus reporting can be found at abc15.com/coronavirus. We'll have newscasts coming up at 4, 5, 6, 9, and 10. Didn't want to miss any of them there. 9 is over on our sister station, CW. And Garrett can be found on Twitter at Garrett_Archer. I'm on Twitter at Katie Rammel. And then if so many of you watching would prefer Facebook, and that's where you're watching from right now, an easy place to find me is facebook.com/news from Katie. So you're seeing all the places that you can find us there. Send us your questions. If there's something we didn't cover, we can try to get to that tomorrow. And Garrett, in the meantime, stay safe out there. Stay masked up. People were asking me questions. I went for a hike today with my mask on, but the trail gets very thin, very slender, and you're kind of climbing over each other in some places. So I would say about 90% of the people up there on the trails now are adding masks back into their hikes. So anything else we need to watch tomorrow? Are you laughing in the comments? They're silly comments.
No, so yeah, tomorrow is, as you said, we're going to focus on those Maricopa County numbers, and also the other counties. We'll see what happens. Now, tomorrow we're just observing what happens with the counties, because we don't expect to see any of the counties change their colors, because of that CLI number is not moving at the same pace as the others. So we're not expecting anything to move from yellow to red tomorrow as far as countywide, but we do have to look at those other numbers to see what's going on.
Okay, we'll track it all. We'll have it all for you right here, same time, same place. Stay